Hey,
Hey,
all right. That was such a good talk.
that was so good. I feel like that could have just gone on for a whole nother hour.
It could have. That's such a layered topic. And Mia brought so many good points. Like, I'm serious. I am about to be all up on social media this weekend talking about everything we talked about.
But Mia is amazing. Like just from our little short time yesterday, I was just thinking about everything she said and just
Yes.
processing like, wow, like
I
we
ain't
ain't
gonna
gotta
lie.
do.
I know. Sorry. Hey, thank you for those of you who are already here. We were just talking about our former talk. I'm Dr. Jess about checking bias, which actually does factor into what we're even going to talk about today with breastfeeding while Black.
Absolutely.
We were just, if you missed that talk, I don't know, Marie gonna have to try to find some kind of virtual replay option to get
Yes.
guys up in there. So we're gonna give a few minutes just for a few more people to join, and then we'll go ahead and get started. Okay. All righty. Give it one more minute. All right. Well, thank you all so much for coming. Like, this has been such a fantastic webinar series already. I am Dr. Jess Daigle. I am and here to be the moderator along with Ray. We're going to co-moderate because our
Yes.
person had an emergency. So you know how it is in life. We got to be able to pivot.
That's how it is in the birth community. We have to be flexible. We just have to roll with it.
That's right. So we're going to talk today to you about breastfeeding while Black, normalizing, educating, and empowering. And so I'll introduce myself and then I'll let Raven introduce herself.
Absolutely.
All right, good. So I am Dr. Jess Daigle, and I am a board certified pediatrician and NICU and pediatric hospitalist, which means I take care of little babies and little people in the hospital, which I love. And I'm also the founder and CEO of Mom and Me MD, which is an in-home and virtual care practice for moms and their new little babies in Atlanta, Georgia. So that means when you bring your little baby home and you like, this would be great if a pediatrician to come see me in my house, that's me. So tell a friend, tell a sister. And so just a little bit of background about me. I got my bachelor's in science and chemistry from University, and I got my doctor of medicine from LSU University in New Orleans. I did my pediatrics residency training at Morehouse School of Medicine, and I did extra training in neonatal perinatal medicine at the University of Maryland Medical Center. I've since worked in the NICU nursery. I've served as a medical director at a level 2 NICU at Wellstar, and now I just travel as I build my businesses to help moms and babies. I am extremely passionate about families, moms and babies, especially my NICU families. And I am a mom of 2 premature infants, so I know it, I got it honest. So thank you guys so much for having me. Okay, Raven.
Okay, welcome everybody. My name is Raven. I am a nurse of almost 10 years, which is almost like hard to believe right now. I have some hospital background, but I did most of my nursing in public health, which is what led me to being interested in taking care of moms and babies. And after an experience with infertility, I had my son and I became a full spectrum holistic doula, a certified breastfeeding specialist, and I will fingers crossed it for the IBCLC exam in September. So everything babies and breastfeeding, and I breastfed for almost 3 years through tongue tie, allergies, eczema, everything that you can think of, I breastfed through it. So I'm so excited to have this conversation tonight.
Good. So what the first question we'll kick off with is, what are some of the unique challenges Black women face when it comes to breastfeeding?
Absolutely. I would love to talk about this because I feel like this played a big role in my own breastfeeding journey. And one is that we are in survival mode when we enter into the postpartum period. So, right, we're thinking about, am I going to just be alive in the next day to be able to bond and care for this baby? And also, we might not have the generational support that other people have to stick through with breastfeeding, right? Because if your entire family and village is behind you saying, are you sure that milk is enough? Like, don't you want to put some cereal in a bottle so you can get some sleep, or so your baby is fed? So you got your whole village behind you, making you feel like you're starving your child. I mean, how can you stick with breastfeeding? So it's a unique challenge because it's not that the people before me didn't want to breastfeed. Some of them, they didn't have a choice. It wasn't an option. And we can go even further back to slavery and how that plays a role in us not having the choice to breastfeed our own children, and how that trauma is showing up even now down the line, generation after generation, for Black moms.
That's so good. That's so good. And I was remiss, like, we're talking with our topic. What we mean by normalizing breastfeeding for Black mamas, we mean like creating a culture and environment where breastfeeding is seen as a natural and accepted way to feed our babies without any stigma or shame, which is what Raven has spoken to. And so it really involves providing the education and support to Black mothers, which is important part of what you've even shown, like that history included is so important to help them feel confident in their ability to breastfeed, and addressing the systemic barriers like things like in the hospital with lack of education, or even like you mentioned, the fear of even, am I even going to like survive this experience,
Right.
especially given, the cultural concerns and the way things are happening in the world today. And so it's also addressing these barriers which make it difficult, such as lactation consultant issues, which is when you talk about becoming an IBCLC, that's one of the reasons why I got into breastfeeding too, is because I'd be rounding, and if the person just was off that day, then I'm like, so this just means no one's gonna have breastfeeding help today? Like,
Yep.
how do you decide? Like, sorry, because you wasn't born yesterday at 8 a.m., you're not going to get to breastfeed your baby, or because you were, had a baby on the weekend.
That's it.
Me, you
Or
kind of
not.
thing. I just thought, yeah, I was like, that's just not right, and so that made me say, well, I want to be that one more person that can help a family on their journey, because those first first few days are critical, right? You have to
Yeah.
get buy-in,
Right.
from families. And even I would even argue before that, like the pre-education, arming yourself with the education and support, just like we talked about why doulas are good even in just during the pregnancy journey, because it's having that information before you get to the event, which ensures your success versus
That's
like trying to be reactive. Is better to be proactive. Okay.
That's absolutely it. And I like to tell my clients to be different than me, because I had this idea like breastfeeding, oh, it's just gonna come naturally to me. And so I don't need to take a prenatal breastfeeding class. But then here I am 2 days into this thing, and my baby wants to nurse all the time. And now I'm thinking, this isn't normal. This must mean I'm not making enough milk.
Or
But
start.
if I
Yep.
would have known about colostrum and the size of an infant's tummy, then I
Yeah.
would have known this is normal, right? But
Yep.
all I had ever seen was bottle fed babies from childhood through
Yep.
nursing school. I had never seen a breastfed baby my whole life.
Ooh.
So I thought that my baby was supposed to be taking ounces at 2 days old. And that's what the nurses was telling me. And I wasn't making ounces. So I just knew I was failing. But if I would have had that education beforehand, we could have avoided that whole scenario.
Ooh, I need to record you. Ooh, I'm glad we're recording this. Marie, I need to borrow these recordings. We need this to make some social media content, okay, to help
Right.
our families.
Please.
Because I actually I had a young lady in the hospital. And when I have a family, I go and I ask them, because I like to be considerate of people's feeding plans. I don't make no assumption either way.
Right.
But they tell me that they want to do breast and bottle. I do ask a little bit more questions. I'll say, so what is your reason for wanting to include formula? And you know what it is, well, I just not making that much. And then you see those, and I actually am making a reel on this tomorrow about these ready to feed bottles that got 60 mLs in it. How
Yep.
can you expect the family to feel like visually, we're already visual people. And so
Right.
they got to look, they thinking I'm competing with that. And you're right,
Exactly.
because of the history of seeing that. And we already like to do everything overeat. Had a family laughing. I say, you can't even get a small at McDonald's. I asked for a small. I was like, well, I guess I'm gonna have to get the kid size if I want a small cup. Everything is big and oversized, and you got to be eating this much. And so
Exactly.
families really, a mom coming from a good place, she wants to feed her baby. Like it makes
Right.
sense, right? Like that's not wrong. It's just that we're providing imagery that suggests if you're feeding this much or you're not making this much milk right out the gate, then
That's
it's not right. Couple
that's
that with the lack of education amongst medical staff, because I was telling the family, I was like, even as physicians, we were taught the benefits of breastfeeding, but we were not taught how to help a family successfully breastfeed. Like I can quote you all the benefits, when I was in med school and even when I was a resident, but no one told me like what I need to say to a mom to begin with, with the positions and all of that stuff. I had to just get interested in that on my own. And I was even supportive of it even as a resident before I had my children, but I still became much better at understanding when I had children. And so I think that's one of the barriers too, is that a lot of people are working in these spaces that don't have the children, so they don't have the same investment in making sure a mom feels successful on that
that's
journey.
it.
Because for them, it's just checking off a box, like the baby ate or not, did he pee or
Right.
not?
Right.
And if
Right.
they
Right.
haven't done that yet, they, oh Lord, it's 12 hours, they haven't peed yet, and so everybody falling out and having a heart attack and say the
That's
baby
it.
needs some formula. And you're like, no, let's
Can we
slow it
bring it
down a
back
little bit.
in? Bring it back in.
Bring it in. And so I see this real time every day. And so I had to have the conversation with that young lady. I was like, like Mia was saying, address the fear. So what are you afraid of? Okay, let
Right.
me educate you a little bit more about colostrum and letting you know some things you can look at to know your baby is doing fine and give you some reassurances. And again, that's where that education and then hearing it from somebody who looks like her, like, hey, I get it. I had that same concern. I understand you're trying to
That's
compare
it.
it to this 60 mLs. Don't do
Right.
that. Not the same. It's not the
Right.
same.
Right.
Yeah.
That's it. And I think if on the provider side, if we could address that fear more, we could see an increase in breastfeeding rates, right? Because if we could meet a patient and say, hey, I understand that you are afraid that you aren't making enough milk. Who wants to not feed their baby enough, like realistically?
Yeah,
But
realistic.
look, this is what the bottle has in it, but this is the size of your baby's tummy. Like, what a big difference that
Yes,
makes,
it does.
right?
Yeah. I love that. And I actually now wear on my badge. I wish I had it. It's in the car. I actually have like a little
Got that life.
marble and I wear it. So I was like, this is the size of your baby's tummy. Like, so they can get
Right,
that visual. So it's
right,
like, see how like
right,
you actually you're going to stretch that tummy out and then they're going
right,
to be sitting up and then you're going to feel bad because now you feel like you're causing them to throw up everything, and it's because we just have to understand a little bit more about what we're working with, right? And
right,
even the nutritional value and the immune benefits of the colostrum, need to be preached to them too. And it's actually you're
mm,
giving better than that little like 10 mLs of formula or whatever that they're gonna
right.
get.
Right, right. If we had more understanding about what that little colostrum really does for the
Yeah,
gut health, for the immune health, for the long-term health and lowering the rates of things that are higher in our community, like
yeah,
asthma, allergies,
yeah.
obesity, diabetes, and the benefits for the mom too, like knowing that this will lower my chance of developing certain types of cancers. If people in
Inserts,
our
yeah.
community knew those benefits, then it wouldn't be as simple as you gonna breastfeed or you gonna bottle feed.
Yeah.
You know what
Yeah,
I'm saying?
exactly. And that's how it is. And there's no like encouragement if they want to. And I'm always quick to tell a family, I'm not judging you if you want to use formula. I want to make sure that you are making the decision from a place of
That part,
empowerment and
that part.
information, not fear or misinformation or no information or feeling like you can't do it because that's not the right. You don't want to make an information from that decision. You want to say,
Right,
I have looked at everything. I have considered what you said. I have this and that, and this is my reason. Well, okay. And I
right,
even then I still say, well, at least give them the colostrum. Let's work there. Because sometimes if you just get started, a lot of
right,
times that fear of the unknown, like, well, I don't know. Well, look, I know it may feel weird. I say, but like give it a try, and then sometimes
right,
it's like,
right.
wow, actually, my baby actually did it, or they get excited about it.
Right, right, right. Because some people do think that breastfeeding is this painful experience because
Yeah,
that's what they've been told. And
yeah,
so when they have a different experience than just feeding through pain, then they're like, oh, wait, maybe this is something that I can do. This is
yeah,
something that I can sustain. But nobody
yeah.
want to feed a baby if you gotta grimace your teeth and be all stiff and tight because it hurts so bad.
That's true. And if that's what somebody experienced, I always have to tell my parents that just about even in general, like even hearing other people's birth stories, it's like you don't want
That's
to
it.
assume that your pregnancy or your labor and delivery is going to be the same way as your mom, your cousin, your friend. I mean, it's good to know like some things to like, okay, these are normal things, but going into any experience thinking is going to be like somebody else's is one sure way to just not have a good experience.
Exactly. Exactly. Like at some point, I tell everybody you have to shut out the outside noise because this is a journey that you have to take for yourself.
I love that. I love that so much. So, how can healthcare providers better support Black women in their breastfeeding journey?
Well, I think we already touched on it a little bit when we
Yeah,
said like address the fears that they have and being aware of the fears for one and addressing those fears
yeah,
and being okay with referring to
I
lactation.
love that.
Hello, can we do that a little bit more in the
Yeah,
hospital?
yeah,
Because if you have access to the lactation consultants, we need for the patients to see the lactation
yeah,
consultant.
yeah.
If you don't have access, that's different. But being okay with saying this is not my specialty, these
Yeah,
people have studied this and they can help you.
I love that. I love that. That's so key. And even you as we've been talking about advocacy, even you moms, when you're pregnant, like start to be. I tell people they need a care team while they pregnant.
Yes,
Start, you getting your OB, you getting your midwife, get your doula,
get
figure
your
out who you might
lactation.
help with relaxation, what pediatrician you're gonna want to see. If you have some history of things, or you need to talk to somebody, if you have some history of mental disorders that you're already like taking medication for, that's just like your health, just like everything else. Get
That's
your
it.
therapist, get your counselor, anything that's going to help you be successful on your journey entering into motherhood. That's your right. Like you deserve that.
Absolutely.
And so,
Absolutely.
like knowing what's in your community and what you have access to, do the pre work so that way you feel a little bit more like, Okay, I've looked at my
I'm so
options.
sorry.
I
Yeah,
know what people are who can help me with what, because everybody, there's some overlap, like how you're a doula that's doing lactation. So, hey, you can find a doula that does that too. And so you can get a 2-for-1 or 3, like my pediatrician that does lactation. Oh, good. My pediatrician knows some more
right,
about
right.
breastfeeding. That's good.
That's
The more skills someone have that can help you, the better opportunities that you have too. And just like anything else, like if you don't, personalities, some personalities mix and some don't. So try it
right.
out. Like if you're like, nah, I don't really gel with that person, that's okay.
That's
Like
okay.
that's why there are a lot of people out here in the world doing a lot of the same things. You
Absolutely.
find somebody that makes you feel empowered and seen and heard. That's what we want. That is
And
what we
it's so much easier to find those people and build that team before than when you are in the thick of it and you are sleep deprived and you got this baby that won't stop crying and you've
want.
been up all night and you just want to give up.
Yes, that is the time. You need somebody to cheerlead you through, because a lot of
Right.
times it's always, joy on the other side of the book, on the other side. And
Right.
you know what I've done? I do that. I speak to those, like when I round, I tell them like, okay, tonight is gonna be that cluster night. So I want
That's
you to
it.
know, I want you to tell me in the morning, Dr. Jess, you was right. Cause like this is like you're gonna think you're starving your baby. You are not starving your baby. I want you to say it with me. I'm not starving my baby. Like I actually make them like chant it.
See, where were you 4 years ago, 5 years ago, almost when I had my baby in Atlanta? Where were you at?
I was there. I was at Wellstar. I don't know where you were.
Well, Star, where?
I was at Wellstar Spalding. Where were
Oh,
you?
I was at the wrong Well Star. I was at
But I really do. But even me, and that's why I'm very transparent. Like I said, I was a pediatrician, but it wasn't until I had kids and then I started paying attention to my environment. So again, it goes back to that awareness. Like once providers know that it's something important, be intentional. Like you're working with moms and babies. Like you said, either be intentional about learning about it or being intentional about referring about it.
That's
Okay.
it.
Just like if you don't know everything about the heart, you're gonna make sure they see a cardiologist. You ain't gonna be like, well, I don't know nothing about it, so they're not gonna just get no echo.
Right, right,
We're just not gonna worry about it. No,
right,
you're gonna
right.
send them to the cardiologist because you know that they need help. Black breastfeeding is a specialty too. And they're actually doing like a board certification for physicians actually next year. So I'm gonna take that test. Yeah. Yeah, I'm
Wow. I
excited about
love
that. Yeah, because I was like, do I do the IBCLC? They're like, well, we're doing one for physicians. So I said, well, I might as well just wait and do
Yeah,
that
you
one
should do
that way.
one for
Yeah.
physicians,
Yeah,
definitely.
because I actually want to do like a breastfeeding medicine clinic in Atlanta too. Yeah.
Wow, it is my dream. I'm no longer in Atlanta, so I'm in a rural part of Georgia right now, but it's still my dream to have a breastfeeding center here because there's just no resources.
Yeah.
And that makes a big difference when you can even like access care and when you have access to a lactation consultant, like, and you don't have to drive 2 hours to get there.
Good. Yes. So there is a question that we had in the panels. How do you help a patient that is unable to or has trouble breastfeeding, especially when it comes to the patient's mental health? You want to take that one?
Yes, absolutely. So please, I'm
You got a
sorry.
little person.
There's a little person tapping
Hey,
all
it happens.
over me trying to
It happens.
ask me to do something. Um, so I think
They
the
have
first
trouble.
thing,
Mhm.
yes. So how do I help a patient who is having trouble breastfeeding, especially if it's causing mental health issues? So my first thing with all of my patients is that I try to get understanding of the support level that they have, because
Good.
that is going to make a difference in you being able to stick with breastfeeding, whether that's breastfeeding at the breast or if you are choosing to pump. There is no way that you are going to be able to do it all and you're trying to establish breastfeeding. So a lot of times what I find is that my clients are on the team doing too much and they are not allowing people to help them. And so they think that it's only the breastfeeding that's causing them to be burnt out, but really it's the fact that you're trying to breastfeed and you're trying to clean the house and you're trying to go run and do all of these errands. You have to let somebody help you. I don't know who told us that we had to be superhuman while we were postpartum, but that is totally false. And I am team feed the baby and pass them off. Somebody else can do skin to skin. Somebody else can change the diaper changes. Somebody else can tidy up, but your job is to take care of you and nurse or pump. Somebody else can even wash the pump parts, but you do not have to do it all. And I mean, obviously, after that, if there is still some issue with breastfeeding or pumping, and if it is truly too much, then we can address combo feeding. Like, it doesn't have to be all or nothing for everybody. Like, those
Yes.
goals are different, and we can flow and we can adjust, but it's about first understanding where you are and what's going on.
That's good. I love that. And I that's why, you see this on social media probably too, about the whole argument about the Fed is best, and people having like various thoughts about that terminology. And I like to tell people, for me, the Fed is best is not the exclusive of breastfeeding, because we know breast milk is best in terms of, like, if we're looking at nutritional
Nutrition.
value. But feeding the baby is the goal. That's
Right.
why.
It's
So
required.
like that's
That's
the goal.
required.
So then, yes, like that's like breathing and sleeping. We need to get it done. So then I'm always like, what is your goal? And I like that you said that too. You addressed that too. What is your goal as a family? Because people are coming with various experiences, and one of the questions was about like the stigmas around breastfeeding, and even in your own community. Like that young lady I asked her mom. I said, I'm just curious, did you breastfeed? And she was like, well, not really. She said, I tried to do a little bit of something. And so again, like you mentioned, like, what are we seeing? It's just like everything else. Like, if you are a little person and you want to be a doctor, who's surrounding you is going to
Exactly.
shape what you see. And either it's you pushing forward and saying, I'm going to go find that person that's doing what I want to do. Again, community examples. That's what we need in the breastfeeding community. So I would encourage your mom, if you want to do this and it's not happening in your family, find the community of moms who are breastfeeding, who
Yes,
have breastfeeding. And that way, because community, with everything, community ensures your survival a little bit better, right? Like, not
absolutely.
meant to do things in isolation. There was a question too about a list of Black breastfeeding consultants or support groups. I don't know specifically like a list. I'm sure there are things through social media for sure. I don't know if they're like an organization that says, here are Black breastfeeding consultants. I'm not aware of that. Are you?
Yeah, I'm not aware of a list right now today, but I do think there's something in the works. But there
Okay.
are support groups, especially on Facebook, for Black birthing people.
Oh, good. I love that. So yeah. So you know what we have now that a lot of people didn't have, and so that's why we should take advantage of it, is there are a lot of communities that you can find yourself in. And just like everything else, you vet the community, you join, you're like, I don't know, I either gel.
Right, well, no, this is me or not.
Does this information sound right? And because I have had some people tell me they've had some poor experiences with some lactation consultants too. And so just like that can happen with physicians. Look, she's a lactation consultant, had a poor experience with a lactation consultant. That can happen too.
Hello,
I don't
lactation consultant told me my baby did not have a tongue tie, and he
see.
did.
Yeah, see, so don't assume that just because someone is in a certain area, they necessarily know everything. Just like everything else, come with some knowledge, ask questions, be willing to get second opinions. All of that is valid to help you on your journey. And sometimes I switch pediatricians. I'm a pediatrician for a living. And I was like, no, I'm not getting down with what this lady is about. I went to a black male doctor. I was like, you know what, and been loving him. So like, even me, and I could technically take care of my own children. I know everything that I need to do for them when they're sick, give vaccines, everything. But I still picked someone who looked like me to help me, in my situation, who will understand my experience and things like that.
Absolutely.
Even with all I knew, it still was important to me to have that shared experience as well. And someone said they love that you brought up how Black women are superhuman. Yes. And that is something that one of my line sisters brought up one time too, before culturally, even why we struggle with self-care, is because that stigma, that is even a stigma and bias that's pushed upon us, like
Yes.
strong Black woman, like,
Yes.
and like that doesn't mean you can't cry, you can't be sad, you can't be vulnerable, you can't not want to just have a break. And we sometimes do that disservice to ourselves in our own community.
We do.
So, I've really tried to encourage, like, even in my own community, for us to stop pushing that label on ourselves. And, it's because we do it to ourselves, because we have had to fight outside so much that we bring it internal in a way, So we just have to be more intentional about saying, even viewing ourselves that asking for help is not a weakness and making that intentional on yourself. And I know personally, I had a better experience with my second child compared to my first because of allowing people. I had a lady that was there ready to, when I came home, she helped with the cooking, the cleaning, all that. The first time I was trying to do all that. And I was like, no, ma'am.
Right. No,
Different experience.
that was definitely me. And my doula was like, what are you doing? Like, you are doing nothing that I am telling you to do. I told you to go lay down. That is why your stitches are not healing. This is why you are in extreme pain every day, because you're trying to cook. We have meals in the freezer. I'm gonna need you to put it in a crock pot and warm it up. Like, it's okay. But I realized I was trying to be superwoman. I wanted to be up moving around postpartum, like the people on social media and snapping back and doing all the things. And she was like, this is not real life. And I even remember like it being that image being in the village. Like, if I would go for a walk for 1 minute and leave the baby with his father, and my grandma would call, it's like, where's the baby? I'm like, do I not deserve 1 minute for a walk by myself? Like, it's
Exactly.
just all about the baby now. We just forget all about the mom.
Yeah, exactly. That's so true. So yeah, I've even started to do better with like encouraging people. I started doing like a postpartum planning workshop. And I've even started advising moms, like when you're having these showers, stuff, ask for practical things like that. Like, you know, help fund me to get like
Yes,
a doula or a
yes,
lactation consultant or a pelvic floor therapist or a nanny
yes,
fund or
nanny.
night nurse or whatever. Because they
Yes,
don't need like 800 pieces of clothing. Okay. Like,
exactly.
you can buy clothes as they grow, but in that immediate 1 month for sure, having somebody help you around the house and with meals and things will do a loads for your mental health. And I think that's why we struggle so much with mental health, is because you're right, the overload of the stress and the overwhelm of everything. So someone did have one question too about, I'm trying to get back to, I got too many windows open.
Okay, I'm looking.
About breastfeeding for HIV positive minds changing. So yes, if a mom has been, from my understanding, she's been on the appropriate retroviral therapy, the ART, the heart, and all those different terms. Then there's and their viral load has been controlled and things like that. Then there's a less than 1% risk of transferring through breast milk. So what I would tell someone to do is, if you know that's your situation, again, like we talked, well, y'all wasn't, if you were in the last talk, we talked about that preconception visit.
Yes,
So any mom who is not pregnant and is thinking about it, have a preconception visit with the OB to maximize your health. They were going to go through a thorough analysis of your health, your history, and say, how can you optimize your health for your pregnancy journey? And so doing that ahead of time is key. And I think, I something I wish I would have even done, to be honest. I feel like I got better at it between the second and third for sure. But, I think I was just like everybody, let's just get pregnant and go on with it.
I think the only reason why I was intentional about it is because I was struggling to get pregnant. And so it was a journey. And that's the only time that I learned, like, oh, I was already supposed to be taking prenatals. Nobody told me to start taking prenatals before I was, started trying, until I was already diagnosed with infertility.
Yeah.
And they told me.
Yeah. And congratulations on that, by the way. That's testimony, because
No,
like your story of having your little one, I think is worth celebrating.
thank
So
you so much. There definitely would be another talk about bias in that community and experience, but
oh
I'm
wow,
grateful.
I didn't even think about that. See, it shows up everywhere, doesn't it?
It's
I tell you,
everywhere.
my goodness. So let's see, we got we got about 10 to 15 more minutes. I didn't see any more questions there. So let's
Okay.
look at some of our other questions.
Okay.
Um, what you kind of actually spoke to a lot of it, like what role do family members and partners play in supporting women breastfeeding. I think one big piece is while you're doing your own pre-education, whoever is going to be one of your main support people,
Yes.
to have your 911 crew,
Yes.
let them be a part of that education too. Just like Mia mentioned on the previous thing, we assume the dads and the partners and the people don't want to be involved, but it's because we're not intentional about including them. And we need to do better, even as birthing people, workers, the people, the moms having the babies. We
Right.
need to say, hey, this is include them all, because a lot of times they just kind of clue deer in headlights too. Like, what do you know? And think about the message they have gotten through their own experience, right? Everybody is coming to this experience with some preconceptions, some exposure, some experiences, some lack of education or information. And so we have to say, what do we desire? So I ask Mom, what is it that you want? Okay, then bring everybody in so that way that experience can be optimized.
Absolutely. Like, I believe that childbirth education and lactation education, it all needs to be taught to the village and not just the birthing person, because they're not going to go on that journey, either journey alone.
That's good. That's good. And someone brought up it's important to normalize human milk. I hear so much from families that they would not never use donor milk, but we use formula. We don't hear about the benefits of human milk in general. I agree. I think that's true. I think it's just that we need to just keep running the information, and it's going to take some time, but I think just everyone can be, even you, Sharmika, you can get on your social media and be like, you know what, y'all? I just want to talk about the benefits of human milk in general. And, you can start spreading, because that's one more person that's going to read your page that's going to say, you know what, I didn't think about that. And it might generate a discussion. Like, each person here, if you commit to sharing something that you've learned about breastfeeding or experience, or what, even if it's I struggle because I didn't have this will get the next person talking about, well, how can I make sure my experience is different? And then that'll get them getting stuff in place. So each of us can kind of reach one kind of a thing.
Absolutely. And I know I'm preaching to the choir, but especially when it comes to preemie babies and the benefits of breast milk or human milk for those preemies is important.
Yep.
It's important. And people don't know that.
That's true. Yeah.
And maybe you can shed light on this and let me know if this is true or not. But I was told in the hospital that you need to advocate more for donor milk from the beginning if you want your baby to receive that donor milk, because after you begin supplementing, sometimes they won't then switch back to donor milk.
So this is what I say. Now, the hospital where I was, we didn't offer that. And so what I would have, I think one is knowing what your hospital system is capable of.
Okay.
I don't think all hospitals offer even providing it. Like,
wow.
If I started with Spalding, we didn't, but I know, I think in Kennestone, I think they did have it. So even all and that's why I have to tell some families, all hospital environments are not created equal. All NICU environments are not the same. Some NICUs, you can live in there with your baby for the whole time. Some of them in an open bed space where the curtain is drawn. And so all of these little factors and little differences actually impact the type of care that some receive, or their experience, not necessarily the type of care, but their experience may be different because of that. I do think, because, donor milk, unfortunately, which that's just a whole nother thing. Like, why are we even charging somebody? If somebody didn't donate it.
Hello.
I know people gotta make some money and stuff, but y'all need to treat it like a 501(c) and get some donors up in there to pay y'all, give this milk free to people. We should not have to be, especially create some criteria. Okay, you in the NICU in these first number of days till your mom get her supply up or whatever. You can there's some kind of way to improve it where it is accessible. And one of our, hey, Dr. Latoya, she's on here, and she said that she had to give her daughter donor milk. And she was glad it was an option, but she didn't even know it was one before. And this was a hospital she worked at. So that's one thing too that's interesting. Are certain things not being offered to even us as Black birthing people, because the assumptions that, well, they're not gonna really care, or is it a waste to give it to us? Just like when Mia talked about, when we were talking about the wimpy white boy thing. Okay, well, they're more likely to need that surfactant and stuff like that, so we're gonna go ahead and give it to them. But well, no, he's 24 weeks and was born 24 weeks too. He needs some extra surfactant too.
Exactly.
Black baby don't mean he don't need it either.
Exactly.
Yeah.
Exactly. Yes, and this kind of all goes back to knowing and researching beforehand where you're going to be giving birth at and where you're going to be staying, so you know what's available to you and your baby.
So Marie was saying something here, but I didn't know what she was saying. She said for some people calling it breast milk can be confusing or off-putting. I don't know. What do you mean by that, Marie? If you can come off the mute.
Maybe she was talking about how we should just talk more about the benefits of human milk, period. I know with some of my
Oh,
clients, they
okay.
automatically X out the idea of breastfeeding, but then I'm like, well, pumping is still breastfeeding, right? But
Yeah.
does it make you feel better for me to say like we're going to be providing human milk in a bottle for
Oh,
you?
that's
And
interesting. I never thought about anyone having any issues with the language of that. And see, like, Mia talked about that too, right? Like how language,
important.
language that is used, everybody may perceive different things differently with that. Okay. Wow. Look, goodness. Okay. I was
Oh my
trying to see, I'm trying to
God.
just scroll through here. What you
Okay, I did see a question over here that I really wanted to talk
okay,
about,
go
which
ahead.
was what can be done to address the historical and the ongoing trauma and mistrust of the medical system experienced by Black women,
I
and
love
how does this impact their willingness to breastfeed, especially thinking about this story that's in the media right now, and the mom with the baby with the jaundice who was
Oh,
breastfeeding
yes.
and had CPS called on her, and now the baby has been removed. How do we as providers now undo the fear that Black moms are gonna have about like, well, if breastfeeding isn't going well, are they gonna call CPS on me?
Mhm.
How do we how do we even begin to address that? What do we do? How do we fight this?
I think that it goes back into bias, and that's why that whole talk with bias, like I said, will relate to this. Is really going to is it going to require that each family have an advocate. Like I feel like I told that to somebody, like each family just needs an ongoing advocate, like that looks like them maybe, that can
Yes,
say, hey, let me talk to this pediatrician that's trying to make these
got
decisions.
you.
I'm going to make sure X, Y, and Z. I even posted about that and I did a live about it. And I said, it's really that in the community, there's just no accountability. That's the one
That's
problem.
it. That's
Like
it.
you can just make these decisions and families can be traumatized and oh, I'm sorry. Well, that's just not enough. We
It's
need to
not
have
enough.
okay, you made this decision based off of this inaccurate whatever, then you need to have some accountability from that, because only when people are held accountable, it's starting to impact them, their money mostly, then they're gonna start paying attention because they're gonna be like, oh, my money being impacted
That's it. That's
by
it.
this decision making, right? Just like everything else in this country, you start messing with money, then everybody want to pay attention. And so I really think that having a support system, and even I think even in the child protective system, like I think every system that's involved with a family and there needs a check for bias and needs some systematic ways of looking at information that
Yes,
makes you say, okay, wait, am I acting biased in this instance? Is there something else I could be doing differently for this family? What's the outcome of a good, we want this good outcome.
that's
What do we
it.
need to do as the CPS person, as the social worker, as the doctor, as the OB, or whatever, to make sure that this family has this particular outcome? Because, yeah, did that pediatrician maybe have some experience? Like one of my partners, I'll tell you this, my a guy that I worked with before had an incident, a malpractice case around Jonathan. So he was very, very
Okay.
vigilant after that. Like he was very
Okay.
extra. I'd be like, everybody
Okay.
got phototherapy after that. It would be like two, be like,
Okay.
brother, they don't need phototherapy. He did not care. And so
Okay.
again, not
Okay.
knowing that, see, now understanding his point of view, it made me look at him different, like, oh, that's why he a little extra about it.
Okay.
He had an
Okay.
experience. So if people will be a little bit more transparent and say, hey, I tell parents, like, this is why I get a Billy at 24 hours. Because when I first started working at Wellstar Spalding, it used to just be like, you're trying to learn the protocols of a place and everybody got different protocols and stuff. And it wasn't that everybody got it at a certain time. It was just like, it was at first at the discretion of like a nurse, like, okay, if I thought you looked really yellow, then I'll get it. But then, okay, what about this Hispanic baby that is that part of his color, man?
All right, right, right.
So we had a baby that was going home one time and I looked at him and I got the bill and it was like 18. It was something crazy, like within 2 days, like 18 or something. The baby wasn't even like 48 hours old. And I was like, oh, and so I was, after that, I made a change though. I said, oh, I don't care what you look like at 24 hours, you getting checked.
I like that.
But see, I had that experience that prompted, but it still was for the outcome of, so it was a bias of sort, but it was I'm gonna make sure everybody gets looked at, because you could be pale, you could be black, you could be Indian, and I know that can skew if I'm looking with my naked eye, but I can't argue with a blood test too much, because the blood test is gonna be a lot different. Sometimes skin tone and stuff can influence that, right? Or your perception of, because I had some babies that look one way, and then I go to another light. I was like, whoa, you really are more yellow. I just brought them from like the mama room into the NICU. And was like, wait a minute, different light made a difference.
Right.
So my point is though, but I understand that. And so then I actually tell families that I'm like, hey, I actually have told that story, like, hey, I check everybody now in this case because of this. And that brings understanding, like, oh, okay, well, because we're on the same page. They want to make sure, I want to make sure we all in this together, and I think that if physicians approached, like if they let a parent know, hey, I'm just really trying to make sure, just like you, like we're a team. I always say
in this together.
Just like Mia say, I can't really care that much more about your baby than you. That is definitely your child. I'm gonna go to sleep at night, and you might be, if something happened, I mean, okay, it may have some legal stuff, but it still was not my physical child. That's your child. If something happens, you're gonna feel the devastation the most. So I don't want that for you. I don't want it for me. I care about you and your baby. So this is what my plan is. This is why it's my plan. See, I tell families what I'm doing, why I'm doing it, what I'm concerned about happening if we don't do it. And then they have all the information. Like, it's okay. Like we should be good at educating. Let's educate. Let's do it together.
Yes. If we just understood that we're all on one accord and we both have the same goal of wanting to do what is best for this baby, then we can have more understanding.
Yes. I agree. And I speak to I know this is disappointing that you wanted to leave today when they have to say, look, validate. People just want to be validated. This does suck. I had to stay an extra day and treat my baby in the hospital too for phototherapy.
I had to stay too.
I miss Thanksgiving. I miss my Thanksgiving turkey. I still tell her, 4 years old. She's like, let it go, Mom.
Man, you're not going home. Just accept it.
But my point is, if we show patients our humanity, just like we understand that they are human, most people, if not, I could probably think of one experience in my 10 years where I had a parent that was just, and he was real racist and he was admitted about it. But I still was able to get done what I want to do because the mom was like, all right, you can be what you want to be, but look, we trying to help you. Okay. Yeah. And then we got it done. Right. But that's like, I mean, that's pretty good in like 10 years to have that one encounter that I can really think of. Most of the time you bring the education there, you can get everybody get on the same page and we get it done. And then they be, even if they was mad about staying the next day, they'd be like, well, I'm so glad we did that because I could have been readmitted to the hospital or whatever. So let's see what Marie said. Somebody said how to change a culture of shaming a breastfeeding person when this happens outside of the hospital or outside their homes of the sexualization of the breast. Let's see how to change a culture of shaming when what happens outside of the hospital. I wonder what happens, Rosa, if you can.
Maybe we're talking about breastfeeding in public. I know that is a very controversial topic. And honestly, it's just gonna take more people breastfeeding to normalize it, right? For us to understand that just like somebody sits at a dinner table and gives their baby a bottle, I can sit at a dinner table and breastfeed my baby with or without a cover, whatever is comfortable for me. That's what I deserve to do. And understanding that it's not about the onlookers, it's just about supporting the person who is breastfeeding. And that's the only way we're going to change this.
Yeah, it's going to take like everything else, like legislation, people being involved, like, rallying people, starting with a few, and getting people like we've brought change to just like how you used to be able to smoke everywhere. Now they took that away.
Right,
You
right.
can't smoke in institutions. And so it's that same kind of dedication to the cause and what's important, what is the health benefit, and trying to drive that practice forward. So Marie was mentioning the doc was entirely wrong. Just speaking back to that case, there should have been better communication. I agree.
Absolutely.
All how it is to vet not only your maternal care team, but also your pediatric. Yes, I
That's
talked
it.
about that in that article that I did. I was on the cover of Baby Whisper magazine, shameless plug. But I
Yeah,
talked about choosing, I talked about choosing your pediatrician. And that's one of the things, like communication, and their character was two of the three C's.
that's it.
Like you can pre-interview anybody that you interested in working with. You can go and meet them ahead of time
Exactly.
and be like, so what are your policies? Do you even do home phototherapy? Do you even, because I have some patients that don't want to be vaccinated. Do you care if I don't get vaccinated? Do you, these are good things to know. What are your values? And then go from
Absolutely.
there. And then know that you can pivot. So like I said, I started with one doctor. When her values no longer align with mine, I chucked the deuces and
Had
found
to
somebody else
switch up.
with no words mad about it and been happy ever since.
No, and I think like that's important for people to understand that you can change providers at any point, at any time, and they're gonna go on about their life. So you don't have to feel guilty about leaving them in the dust if they're not meeting your need. I mean,
Yep.
I had it out with Children's Healthcare of Atlanta and found a new allergist for my child. Like, and no guilt, no shame, because
Yeah.
you're the parent, you have to advocate for what you believe
You do.
in.
You do. And that's why I share that example, because I like people to think it doesn't matter what your profession is. I'm a pediatrician, but it still does not exclude me from certain things as well. And sometimes I actually hold back from people. I'm a doctor just to see how I'm treated, but it
Oh
ends up
yeah.
slipping out because I end up using some type of terminology that nobody else uses. And they be like, "Oh, you in medicine?" I'd be like, "Yeah, I'm
Darn, I gave myself up. I didn't want to
yeah,
give myself up because I want to see how you really treat people. I don't
yeah,
want the treatment that you give your fellow people. I want to have an understanding of how you treat the everyday person, because that's how I want to make my decision.
exactly." And one more question. Let's see if we can scroll through some of the questions. Can be about importance of centering experiences from Black mothers and development of maternal health policy and practice. That's a good question. But I think just to focus on the breastfeeding, one of the things I would like us to bring up is challenging the stereotypes and stuff. I think is if you are a person who wants to breastfeed, it's knowing your environment, like Raven brought up. So if you didn't come from a home that was breastfeeding, it's going to be that much more important for you to educate yourself about it. And
Right.
then plan ahead. Preparation is the key there. Like who's going to be your support person, your support team that can help you out. There's so many environments. I think there's a lady on Instagram called The Equipped Mama. I think she even melanated milk geese club or something. I've been
Yeah.
following her. I really like her energy.
Yeah.
And so, there are people out there that you can join in early enough to get the support. And I think it just starts with each person being committed to getting the support that they need. Because we already know we already know there's a systemic problem. So if you spend your time being frustrated about the lack of support in those systemic issues, you're going to be wasting your time. So
Right.
it's about like, okay, I'm going to do what I need to do to I'm trying to do like that,
Because
right?
I'm
We got
trying to do this.
yeah, because I'm trying to do that. I'm take that type of energy, because otherwise you still end up being the one that loses out, and then you're frustrated, and then you're now
Right.
trying to then you're dealing with guilt about it, and we don't
Right.
want that for you either. So it's
Right.
just saying, I'm gonna get the education, I'm gonna build my community, and then I'm gonna make it happen.
That's it. Because we are trying. We're out here trying to become lactation consultants. We're trying to
Yep.
add more diversity to the field. There are a lot of barriers for us who are
Yep.
trying to become lactation consultants. So we are doing what we can do to change things from the inside, but we still have to do the work until these breastfeeding centers start popping up.
That's a good one. Marie said, suggest talking to your partner, immediate family first.
Yes.
The science and the reasons why, get them to understand the benefits. And as they become your advocates, they will support and deflect from the others in your circle who might not be a support. Yes, that's right. It's like anything else.
Absolutely.
Get some buy-in.
That's it. And set a firm boundary. Like if you have people around you who are close and are in your circle, just let them know, like, I am breastfeeding. Do not offer formula. I will not be putting cereal in a bottle. I
Yes.
am committed to doing this. If you're
Yeah.
not supporting, then don't talk to me about it.
I love that. Like, we have to take the pride. I had a family, and they were in the Black family, but I still liked that when they were in the hospital, the mom was like, oh, me and him, we decided we was not gonna tell all these people when we had the baby because we wanted to have an intimate experience. We was
Yes.
with the breastfeeding.
Yes.
And I said, good for you, because we feel so much pressure to have to, like, and it's a cultural thing too, like
It
everybody
is.
being there and everybody want to see the baby and all that. But you have to start to choose, like in your pregnancy, you can start the autonomy that you desire and
That's it.
the control and the boundary setting. Okay.
That's
That
it.
needs to happen in pregnancy. And then you'll carry that idea into your postpartum and even as a mother and a parent, because people will try you. And
Yes.
family is not trying to be mean either. They have lived their experience and they think they know what's right too.
Right.
I have to tell my own mama, I went to med school, right?
It don't
but
matter.
but it still don't matter. Don't go outside with your hair where you can catch a cold. It don't matter. So you just smile. You just have to commit yourself to smiling at these little things and say, you know what? I know they mean well, but this is what it is I'm trying to do. I'll take whatever you have into consideration because, it may be some good advice, but if I've learned better, I'm going to do better. And that's
Right.
how it is in life.
That's it. That's it.
Yeah, well, this has been such a good discussion. Do we have any last minute questions?
I love the idea of creating a script and language. And with my clients, I try to do like little role play sessions so that they are prepared in the event that some of this does come up. Like,
Yeah.
and just know too, just you could say no, but if you want to go into more detail, we're gonna role play to see before you get in the moment how you gonna handle this.
I love that role playing. I do have a reel that I'm gonna make about like ways to set boundaries. I think I have it scheduled. Yeah, like
Yes.
with families is so important. So, because we've all been there, and again, support and community is so key. In whatever situation, there's got so many communities for different things. Like NICU, I'm in some groups myself, NICU moms and new moms and stuff, and I love just being in there just to support other people.
Me too.
Giving them that yes, you can do it.
You got this. Yes, me too.
Okay. So some people are asking for our social media. I think Marie didn't set it up where we can talk to everyone this time. Like in the last one, we could answer in the panel, but I'm at momandme_MD on Instagram. And that's MOMANDME_MD. And then how can they follow you, Raven?
Absolutely. I am Ray the doula on social. So that's RAYE the doula.
All right. I love it. I'm at the follow you. I don't know if I'm following you, but I'm going to.
I think I'm gonna have to.
Oh, yeah,
No, I'm
Marie's
definitely following you. I'm definitely following you.
Oh, well, thank
Yes.
you. Yeah. So I think it's working. And this is what it's going to take, like keeping the conversation alive,
Yes.
putting the information out there, each one reach one. If you learned something neat today that you didn't know, phone up a friend. Hey, girl, I was at this talk and this is something that they learned. Or when you have a friend that's pregnant, hey, how can I be your support person? Or call me in the middle of the night if you want to give up on breastfeeding. Let's talk about it. Or I always tell patients, don't give up without talking to a lactation consultant first.
That's it. That's it.
One good visit, because a lot of times they just need to get through it. You just need to get through that moment.
That's it. That's it. You just need to get through that tough moment.
Yeah. Well, Raven, it was so good chatting with you, and
Thank
thank you guys for so much good comments and everything. I feel more hopeful for sure. Seeing events like this and just knowing even like what my little smart what you're doing and what so many other people are out there doing. I think change is possible and on the horizon.
Absolutely. And this Birthing the Magic Collaborative is part of the change, and the conversation is not over. Please register so you can keep going with the conversations, especially tomorrow. So they're going to be talking about the truth about pregnancy and childbirth. So you have to register to be able to join. So go ahead and register. And will there be a recording available? Fingers crossed out. So please.
I know she has been recording. So
okay.
Will be. Yay.
Okay. Yay. So thank you.
All right, y'all. Well, y'all have a good night.
Good night.
All right. Bye.
Bye.